and I am excited to welcome Angela. This was one of our first sponsors for Flat Out Love, or Flat Out on Flat Top. So I'm going to give it to her because she knows her better than I do, and she's going to tell you a little bit about herself and what she's going to talk about today. Thank you.
All right. Thank you so much. I'm super excited to be a part of this amazing event you guys are doing on Flat Out. On Flat Top. I'm sorry I can't be there. That was always my original intention, but if I can help in any way, I'm very excited. Originally, I was planning on doing this presentation there, but I'm glad to do it here.
Well, you can do that on Sunday there, if you'd like. We do have people coming on Sundays to do different things.
Well, if I could do it virtually, I would be super excited. You can let me know. You can let me know if that would work out.
Okay, yeah, we'll figure that out. Okay, go ahead.
Okay, cool. All right, everybody. I'm assuming everyone can hear me okay. Please just, raise your hand or in the comments down below if you have difficulty hearing me. My intention today is to talk about lymphatic health and exercise after breast cancer treatment. My name is Angela Wicker-Ramos. I have a doctorate in physical therapy. My specialization, I work with people during and after cancer treatment, and I'm also a certified lymphedema therapist. So I work as a physical therapist to help people with mobility, range of motion, strength, endurance, to help reduce side effects that happen from cancer treatments, and then also to help educate people on how your lymphatics are impacted by cancer treatment, as well as if there is any issues with lymphatic circulation, I help treat people with that. I live in Austin, Texas. I own a private practice here, and I also am a co-founder of Moving Beyond Cancer Collaborative, which is a nonprofit organization that offers free exercise and wellness classes for anyone impacted by cancer treatment. And I know that Shandi came on a few Sundays ago, and she's one of our instructors that teaches one of our dance classes. So hopefully you guys were able to attend her class because they're super fun. All right, so today's presentation, I can jibber jabber about this like all day long. So I'm going to try to keep this within an hour, but I can stay as long as people want afterwards to answer any questions you may have at the end. All right, so let's start with what is your lymphatic system? Your lymphatic system, I call this such an underrepresented system in the body because we hear about the circulatory system, we hear about your immune system, but we rarely hear about the lymphatic system until there's an issue with it. So your lymphatic system is kind of the middleman between your circulatory system and your immune system. You always have fluid that's moving through your tissue spaces. That fluid is bringing nutrients to your cells, and your cells are dumping what they don't want or don't need into that lymphatic fluid as well. So it's a highway system that moves fluid through your tissues. And also your lymphatic system has lymph nodes, which are glands that filter out toxins. So it's also part of your immune system. It produces white blood cells to help you fight disease, fight infection, and filter out anything that's not of use to your body. So in this picture here, you can see these are your lymphatic vessels in this picture here, and then you have those lymph nodes or those lymph glands. Your lymphatic system, what's called your lymphatic load, is actually the fluid that runs through your lymphatic vessels. And that fluid is water, like we think of when you have swelling, there's water, but there's also all these other important things in that lymphatic fluid, such as proteins, cell fragments, long chain fatty acids, and those blood cells we were talking about that help you fight infection. So again, a very, very important system in your body. You've got groups of lymph nodes throughout your entire body. You've got groups of lymph nodes in your pelvis, in your abdominal area, in your head and your neck, in your armpits, as well as a few in your sternum area. So if we're specifically talking about people who have dealt with cancer treatment, usually the lymph nodes that are impacted are the lymph nodes in the armpit area or the lymph nodes in the sternum area. So those are called the axillary lymph nodes and the sternal lymph nodes. Everyone has a slightly different number of axillary lymph nodes, but generally it's about 30. Now, those lymph nodes have a very specific area that they drain fluid. So they are in charge of a very specific area. The lymph nodes in the armpit are in charge of draining fluid from the chest on that side, from the back on that side, and the arm on that side. So if we have to remove lymph nodes with cancer treatment, or if you've had radiation because of cancer treatment, then the lymphatic system on that side is injured. That's important to know because when we talk about how you can have a healthy lymphatic system and what are the signs of lymphedema or injury to the system, that's the area where you may see something, would be the chest, the back, or the arm on that side. Okay, so remember that groups of lymph nodes are in charge of a very specific area of your body. The other groups of lymph nodes, such as the other armpit or the pelvic lymph nodes, those are in charge of a completely different region, okay? Your lymphatic system, we've already kind of talked about this a little bit, but it's got different items to it, right? We've got your lymph nodes, we've got your lymphatic vessels, and then the largest lymphatic vessel in your body is called the thoracic duct. Let me see if I have a good picture of that. I don't have a great picture of that, but the thoracic duct, we'll come back to this picture here, is the largest lymphatic vessel, and it runs up the abdomen here. Now, it is the most important lymphatic vessel in the body because it is the epicenter or the largest highway system where all the lymphatic fluid comes together to that abdominal area, and then it moves up, and then it dumps into your veins up here in the neck area. So this abdominal lymphatic vessel called the thoracic duct is the most important lymphatic vessel in the body. So when we're going to talk about how do you promote lymphatic health, and that's going to come up a few times, is the abdominal area and what we can do with that to really promote lymphatic health. The ultimate highway system to move fluid so it can move up and dump into your circulatory system up here in the veins in your neck area. Remember, your lymphatic system is highly connected with your immune system. So if we want to support a healthy lymphatic system, we want to make sure that we're addressing the immune system. So we are going to talk about sleep hygiene in a moment. We're going to talk about exercise, and we're going to talk a little bit about diet as well, because those are important things in terms of promoting your promoting your immune system and helping your lymphatic system that way. Now, if we look at this word lymphedema, and I'm sure everyone in the audience today has heard that word before, but let's look at it pretty closely. We've got lymph and we've got edema. Edema is actually just a medical term that means swelling. So you can have swelling for many different reasons, right? You can have swelling because you're on a steroid and you're just feeling puffy all over. That's a type of edema. You can have swelling because you injured your knee, and that's trauma to the area, so there's swelling. Lymphedema is specifically when your lymphatic system has been injured. So in our case, we're talking about injury because of cancer treatment. And so subsequently, there's a backup of that lymphatic fluid. That's lymphedema, okay? So that has a very specific way that we treat it that's different than if you had other types of swelling. Like we've mentioned before, your lymphatic system can be injured because lymph nodes are removed. Lymph nodes are removed during cancer treatment because it's a way of staging the cancer. There are two ways that cancer can spread through the body: through your lymph nodes and through your lymphatic system, or through your circulatory system. So generally, your surgeon will decide to remove what they call the sentinel lymph nodes first. The sentinel lymph nodes are the first few lymph nodes that the fluid moves from the area where your tumor is through the first few lymph nodes. It's like a chain or like a pearl necklace, right? There's the area or the tumor site, and then there's those lymph nodes where the fluid from the tumor move out to those first few lymph nodes. So now what surgeons do, in the past, they used to just remove a big hunk of lymph nodes. Now what they do is they put or inject dye, and they look at which ones are the sentinel lymph nodes, which lymph nodes light up first. They remove those lymph nodes. They test them under a microscope. If they're positive for cancer, then they'll remove more. So that goes from a sentinel lymph node dissection to an axillary lymph node dissection, where they've removed most of the lymph nodes in the armpit. If they don't see any cancer in those first few lymph nodes, first few sentinel lymph nodes, then they won't go to an axillary lymph node dissection. So that is the way that they reduce trauma to the lymphatic system if they can. Also, your lymphatic vessels can be injured from radiation treatment. So if we go back to that original diagram here that shows you your lymphatic system, any area that has had radiation is going to injure the lymphatic vessels that run across the chest as well. Okay, so just keep in mind that it's not only the removal of lymph nodes, but it's also the radiation that can injure those vessels as well. Now let's talk about lymphedema versus edema, lymphedema versus other types of swelling. Now, generally, every single person who has had surgery, every single person who has had radiation will have swelling. That's a body's natural response to injury. That swelling should reduce over time. That swelling from surgery or radiation should be almost gone within 3 to 6 months after your surgery or after your radiation. If you're noticing that that swelling improves and then it comes back, there may be a lymphatic issue. You may want to let your surgeon or your medical oncologist know. Also, remember we talked about if your lymph nodes in your armpit and the lymphatic vessels across the chest are the ones that are involved, your swelling would only present, if it were lymphedema, in the chest, the arm, or the back on that side, right? So that would be pretty telling too if you had swelling in that region. And then also, it's a pretty firm type of swelling because remember that lymphatic fluid has protein, cell fragments, white blood cells. It's got all of these items in it. So it's a pretty thick sort of swelling. What if you start feeling heaviness, achiness, or swelling in that region? You go to your medical oncologist or your surgeon, let them know that you're experiencing that. What they'll do, they'll test to make sure you don't have a blood clot. They'll test to make sure that you do not have an infection. And then they'll let you know if you have lymphedema, and they'll make sure that you get in touch with a certified lymphedema therapist for treatment, okay? Lymphedema does have treatment that can help significantly reduce it. Lymphedema can happen at any point in your recovery. It's not just right after surgery or right after radiation. If you think of your lymphatic system as a factory, in the factory, you have something that the factory is trying to produce, right? So in this sense, it's trying to move fluid through your body, get the nutrients to where they need to get to. If a factory worker is injured, or if a whole bunch of factory workers have been laid off, so your lymph nodes have been removed or radiation treatment has injured them, then it can't work as well. It doesn't mean it's not going to be able to ultimately produce what it needs to as a factory, but over time it may tucker out and not be able to produce the same thing, right? And so sometimes people are fine, they don't have swelling of concern, and then 5 years, 10 years later, they might see swelling that could be lymphedema. So I just want to let you know this because the sooner you catch it, if it is an issue, the sooner it can be treated and well managed, okay? Again, if this is swelling just because of surgery or radiation, it should be reducing over time. You should be definitely seeing improvements. Swelling lymphedema symptoms include swelling, but also heaviness, achiness, or tightness in the area. Restricted range of motion. If you start noticing swelling in your hand and you feel like your hand grip is just really tight, that could be lymphedema in the hand, or aching and discomfort. But also note that sometimes these can be symptoms of other things as well, right? So that's why you definitely need to go to a medical doctor that is in your oncology team to make sure that they are aware of what's going on. The greatest risk or the actual highest incidence of lymphedema is because of cancer treatment. Yes, it does come along most often 5 years after your cancer treatment. It can come along at any time. So education, like what we're doing today, is very important. When you've had an axillary lymph node dissection, or when you've had most of the lymph nodes, remember we said there's about 30 in the armpit, when you've had most lymph nodes, so like 20 or more dissected in the armpit, your risk for getting some form of lymphedema is about 30%. If you've just had the sentinel lymph nodes removed, so that's about 1 to 4 lymph nodes, then the risk is 5 to 15%, depending on if you've had radiation treatment or not. Prognosis. The sooner we catch this, sooner it's treated, the far less of an impact this is going to have negatively on your life. There is treatment that can significantly reduce that swelling. So important to just keep your eye out. Here are some images of lymphedema. You'll notice that she has some swelling right here, swelling on the side of her chest, and there is even a little bit of swelling down here. It is common after you've had a mastectomy to have a little fat pad along the side of the chest here. That's not lymphedema, okay? And that's really common to see it. Lymphedema is a more squishy, sort of water-based swelling here, okay? Also, lymphedema can show up in the arm on that side where the lymph nodes and the lymphatic vessels have been injured. This is a mild case. And don't be alarmed or scared. This is someone who did not undergo treatment in a timely manner here with this picture of the arm. But it can progress and worsen without treatment. So I just want to make sure you guys are aware of what that would look like and when to let your doctor know if you're noticing something of concern. Now, in terms of lymphatic health, there are things that we can do to really promote lymphatic health. The first thing is drinking plenty of water. Because lymphatic fluid has a lot of protein content in it, if you drink enough water, that really helps that lymphatic fluid flow and circulate through your body. 8 cups of water per day is a very generic recommendation. Everybody is different as to how much water they need in a day. So I prefer to just let people know, look at the color of your urine. You want it to be fairly clear, and you want it to be a real pale color. I know it sounds a little gross, but that's the best way to know whether you're hydrated or not. And also in terms of how frequently you urinate, the average in terms of the frequency of your urination for people is about every 2 hours, 1 to 2 hours. So if you're not having to go to the bathroom until like 4 hours, that means you're probably dehydrated, okay? So you can also look at it as the frequency of urination is generally about every 2 hours for people. All right, risk reduction practices. So now we know a little bit about lymphedema. What can we do to reduce our risk? There are certain things that are specific to the cancer treatment that you underwent. That's not within your control. Those were important interventions to save your life. And we're going to talk about that. But then there are other things that are in our control that we can do to really try to promote that healthy lymphatic system. What we're going to talk about in the next few slides are based on systematic reviews. And what those are research articles that compile every single article they can find on a particular topic. They assess whether that research article is good or whether the research was done poorly. If it looks like a poor research study, then they won't include it. If it looks like a high quality research study, then they'll look at it. And they take all that together and then they look at the findings. And so what we know from the systematic reviews regarding risk of lymphedema, we know that the stage of your cancer and whether you had positive lymph nodes or not definitely impacts whether you have an increased risk of getting lymphedema. If you had an axillary lymph node dissection, ALN, versus just the sentinel lymph node biopsy, definitely axillary lymph node increases your risk versus sentinel lymph node. Radiation intensity, radiation location, and radiation frequency, how many radiation treatments you've had impacts your risk. And then inflammation, so whether you've had infections in the area, whether you've had wounds that just won't heal, that can definitely impact it as well. Like I said before, these are things that aren't within your control, right? These had to happen. It's just part of your cancer treatment, unfortunately. But there are things that we can control. And one of the things is your body mass index, or how much fat your body is holding on to. And the reason that is important, we know that people that have a higher body mass index have an increased risk of getting lymphedema. And in an upcoming slide, I'll tell you exactly why that is. Also, restrictions in your motion or tissue tightness. So if you have a pretty firm scar across the front of your chest or in that area where you had the lymph nodes removed in the armpit, if that's really taut and really tight, imagine that's a barrier to your lymphatic flow, right? Now, what's great is you can massage that scar once you've got your surgeons okay, or once you're about 6 to 8 weeks healed from your treatments. You can start massaging that scar with lotion every single day. That'll soften that scar, that'll break up that scar tissue, and that'll help improve lymphatic flow across that scar. So that will help promote lymphatic circulation. If we're talking about obesity and lymphedema, the reason why being obese is actually an increased risk factor for getting lymphedema is because fat cells secrete hormones that damage your lymphatic vessels. And when they damage your lymphatic vessels, you have more lymphatic fluid leaking out into the tissue spaces. So what we want to promote is a healthy lifestyle of physical activity and healthy eating. There is strong evidence that physical activity significantly helps your lymphatic health. Reason that is because let's talk about your circulatory system. What organ is in charge of moving blood through your body? That's your heart. Your circulatory system actually has a primary pump that moves fluid. Your lymphatic system, completely different. Your lymphatic vessels need your muscles to be pumping. They need your muscles to be contracting and relaxing to move that fluid through your lymphatic vessels. So a sedentary lifestyle is very challenging on your lymphatic system. That means your lymphatic system doesn't have that pumping action that it needs. So any form of physical activity, the research shows it could be any form of physical activity. We're not talking marathons. We're not talking about hiking. We're talking about swimming, even a gentle walking program, dancing, anything, doing laundry, going up the stairs to do laundry, up and down the stairs. Anything that really gets you moving is helping your lymphatic system circulate. Now, in the past, before they were doing research on lymphedema, and I mean like 25, 30 years ago, they were telling everybody, do not lift heavy things with the arm that you're at risk for getting lymphedema. They would say, do not exercise. And that is absolutely incorrect. What you need to be cautious of is trauma or injury to that area, because that'll create inflammation. So if you're strength training smartly, I don't know if that's correct wording, but if you are intelligent about how you're strength training and you're doing it gently and you're progressing slowly, there is no ultimate amount of weight that you have to stop lifting at, right? You just have to make sure you're not injuring the area or creating inflammation or swelling to the area. So when I start working on strength training with someone who's at risk for lymphedema or someone who has lymphedema, even if, let's say, before surgery and radiation, they were lifting 20 pounds, we start with 0 pounds or 1 pound. And then we gradually work our way up to wherever they want to go to, right? So we can work our way up to 150 pounds. But we just want to make sure that every time we're increasing our weight, we are not significantly sore, not so sore that we can't do the same exercise the next day, not creating trauma to the area, okay? The general guidelines for exercise is doing some form of strength training 2 to 3 times per week, doing some form of aerobic exercise 4 times a week. So that could be anything that increases your heart rate and respiratory rate. And there can be overlap with your aerobic and your strength training activity, right? So it can be, if you're riding a bike, that's both aerobic and strength, right? And then you want to do stretching every single day. Remember how we were talking about tightness across the front of the chest impacting lymphatic circulation? So make sure that you're doing some form of chest opener every single day. Chest opener can be in a doorway. Chest opener can be lying down and just relaxing your arms out to the side. Chest opener can be lying down on your bed and just, hang. I like to call this the chilling out at the beach position, but anything that really stretches out the front of your chest. And arm elevation to make sure you stretch out this area here as well. So if there's an area of tightness from surgery or radiation, you need to be stretching it every day, okay? Because it's going to have a tendency to want to keep tightening up. That's unfortunately the gift that keeps on giving with radiation, right? And scar tissue. And so stretching every single day is very helpful. What we have insufficient evidence on in terms of risk for getting lymphedema in those studies that we were talking about, using a blood pressure cuff on the side where you're at risk for lymphedema, getting your IV or blood draws on that side. If you have a seroma, which can be a complication from surgery, that doesn't demonstrate an increased risk for lymphedema. Any form of reconstruction, which I know is not a real important discussion today. Post-operative swelling, hormone therapy. So if you're on a hormone therapy, such as an aromatase inhibitor or tamoxifen, that has not been shown to increase risk for lymphedema. Airplane travel, hot tub use, or alcohol consumption. Now, I'm going to say all of this with a caveat because there are reasons why we want to be cautious with most of these things. Alcohol consumption. We know that there's an increased risk for cancer recurrence with alcohol consumption. Okay, so do keep that in mind. In terms of hot tubs, we do know that when your body gets overheated, your lymphatic system has to kick in and try to help out. So I tell people, although the research doesn't show that being in a hot tub increases your risk for lymphedema, do it minimally because we just want to be kind to our lymphatic system. Similarly, with a blood pressure cuff, if you have the choice of doing it on the opposite side of where you had your cancer treatment, go ahead and do that because we don't want to create a tourniquet effect in the area or the side where you've had your surgery. And then same with IV and blood draws. We don't want to create any open wounds or we don't want your lymphatic system to have to work hard bringing all those white blood cells into the area where there's an opening in your skin from IV, blood draws, vaccinations. So if you have a choice, go ahead and get it done on the other side. However, if you don't have a choice, if it's an emergency, don't panic. Let them do it wherever they need to do it, okay? Because there is not enough research to state that, oh, someone got their blood drawn on the side of their lymphedema risk and they got lymphedema because of that, okay? So again, I tell you these things just so you can make an informed decision as to how you want to proceed and just understand the risk associated with it. We're going to talk about airplane travel in a moment. So 3 easy ways to promote lymphatic health. We're going to go back to our discussion of the biggest lymphatic vessel in the body, the thoracic duct that runs up the abdomen. Deep breathing, such a simple thing. We do it in yoga, we do it as stress management, and it is so powerful in stimulating the lymphatic system. I was super excited to be part of a study where they injected dye into my lymphatic system. And then all I did at the very beginning was deep belly breaths. Doing deep belly breaths stimulated the lymphatic circulation up here in my arm, my head and my neck area. So I wasn't even doing anything up in my arm or the head and neck. I was just doing the deep breathing. And because there's that large vessel in the abdomen, it stimulated my entire lymphatic system. We've known that from textbooks for quite some time, but it was really cool to actually see it with this imaging technique. So deep breathing, it can be in a yoga practice. It can be with aerobic exercise. It happens naturally when you do your aerobic exercise, you do deep breathing, but it can also be just sitting at a stoplight, right? Doing your deep diaphragmatic breath, where you expand your belly with your inhale and you scoop your belly with your exhale. Decreased stress definitely can stimulate or promote lymphatic health. Now, I know we say life is stressful right now. Life is stressful for everybody. Someone who has had to deal with cancer treatment, life is very stressful. COVID, everything we're dealing with in life, we have stressors that are coming at us at all times. So it's simple for me to be like, hey, get rid of the stress in your life. That'll help your lymphatic system. But I'm also a realist and we can only do so much with that. But we can do the best we can to try to have good coping strategies for stress, try to have moments where we center our mind, and just try to have as many strategies as you can to deal with life stressors. And then we talked about hydration and how important that is. Okay, so risk of or promoting lymphatic health. We want to reduce our risk for infections because remember, our lymphatic systems, one of their jobs is to help ensure that we don't have infections. So an area where you're at risk for getting lymphedema, if you get a cut or a scratch or anything like that, keep it clean, Neosporin, bacitracin, something on it, and then put a Band-Aid on it. And then watch for signs of infection because people whose lymphatic systems are injured are more at risk for getting an infection called cellulitis. Cellulitis is an infection of the tissues, and what it looks like, it's heat, it's redness, sometimes it's fever, it's increased swelling, and it's pain. If that happens actually, if that happens anywhere, obviously, but if that happens in the area where you're at risk for getting lymphedema, you need to go to urgent care, okay? Because they'll put you on an antibiotic. It is something that, should be taken pretty seriously. So again, that infection, cellulitis, looks like redness, fever, significant increase in swelling, pain, and heat or warmth in the area, okay? You want to try to also avoid too much restriction in any area where you want lymphatic circulation, right? So in terms of if you're wearing any jewelry along that arm, if you're wearing a shirt that has a elastic around the arm, you just want to make sure that that's pretty loose, okay? I know this is an exaggeration in this picture, but I thought it looked goofy. So yeah, just be cautious with that. And then avoid excessive redness to the skin. So sunburns, anything that is creating that sort of inflammation to the skin, you want to be cautious with that. We already talked about how important exercise is in terms of lymphatic flow. So this is just kind of reiterating that. I will give you guys these slides in PDF. I will have them emailed to you guys, so don't feel like you have to take tons of notes. And there's lots of stuff on these slides that I'm just going to brush past because I know you're going to have them to read over in the future, okay? So hopefully a lot of this information will just be there as a resource for you to look at later, okay? Air travel and lymphedema. We mentioned that air travel has not been shown to increase risk for getting lymphedema, but we know that if you have lymphedema, you need to be cautious about a few things when you are traveling. The first thing is if you have lymphedema, you will have a lymphedema therapist working with you, and they will go ahead and get you a compression garment for your arm and or compression bra or that runs across the chest to compress any area of swelling, okay? Compression bras can be used on flat chests as well if there is swelling, and they make specific ones for that. So your lymphedema therapist will make sure that you are in the right garment, and it's important with air travel that you do wear those garments when you're traveling. Okay. It's also important that you move around as often as you can, because remember, what's the main pump for your lymphatic system? It's your muscles contracting and relaxing. So even if you're sitting in a chair for 4 hours on a flight, you can do shoulder rolls, you can do head movement, you can do little fist pumps, anything that really kind of gets your body moving. And you want to stay hydrated anyway. So you'll probably get up and walk down the aisle to go to the bathroom as well. So very important that you keep moving, you keep hydrated, and if you have lymphedema, you wear the compression garments that your therapist has advised you to wear. Now, remember how we talked about risk reduction and the fact that there's no research to show that blood draws and IVs and blood pressure cuffs cause lymphedema. If you have lymphedema, you do want to be cautious with these things because of that risk for infection. Okay, so if you have lymphedema, you do want to make sure that you're asking for the blood draws and the IVs and all of that on the opposite side. You want to make sure that if you have cuts to the skin or any injury to the skin, that you keep it clean, you watch for signs of infection, all of those sort of things that we discussed. And then in terms of massages, you just want to be cautious if you're at risk for lymphedema or if you have lymphedema. A very deep tissue massage in that quadrant that you're at risk or you have lymphedema. So remember how we talked about it doesn't impact other areas of your body if the lymph nodes that were impacted were the ones in the armpit and the lymphatic vessels in the chest. So if you want to have a deep tissue massage, meaning, you know, they're digging their elbow in there to your lower back or to your glutes or to your legs, that's not going to have a negative impact on your lymphedema, okay? But you don't want aggressive massage in an area where you have lymphedema. That'll create inflammation. That'll make the lymphedema worse. The current National Lymphedema Network recommendations are that you have or you get measurements from either your surgeon's office or a certified lymphedema therapist before your surgery, which I know at this point for most people that's you're like, well, if it happened, great. If it didn't happen, it didn't happen. But also after your surgery, you have them take measurements of your arms and you have them take measurements of the chest area. So you have those baseline measurements. If there is an issue and lymphedema shows up, then when you go back to the office, they can retake those measurements and actually see or compare and see whether there is swelling or not. If you have lymphedema and you have a lymphedema therapist already, it is recommended that after your initial treatment with them, you follow up with them every 6 months the way you would a dentist, and they'll make sure that you're doing well, that your home management program is working, and that if there are any new advancements in treatment or any new advancements in compression, they'll let you know about that too. So the whole point of this slide is to make sure that you are having regular follow-up and that there's someone on your medical team keeping an eye on this and keeping an eye on your lymphatic health. Again, you'll have access to these slides, and here is some information on how to find a certified lymphedema therapist in your area. It is a certification, it's an advanced certification, so you need to make sure that you're seeing someone with the correct credentials and the correct training. So all of these slides are ways for you to look up lymphedema therapists in your area, all of these websites that are listed here. I am going to not talk about lymphedema treatment because I want to make sure we have enough time for everything else, but you will have this as a resource in your slides. And at the end of today's presentation, if anyone wants to hang on and talk about this afterwards, I would be more than happy to talk about this. But I want to make sure that we have a little bit of time to talk about exercise. This last bit will take about 10 minutes, and then we'll have at least 10 minutes to have any Q&A questions, anything like that, okay? Now, this part is talking specifically not about lymphatics, but about exercise in general. And the reason I love to talk about this is because, yes, we've probably heard from our medical oncologists, exercise, it's important. Now, there's two reasons why I think that that is not enough. First of all, how do I exercise? What's best for me in terms of exercise? That's kind of like someone saying you need a particular medication, but not giving you any guidance as to what medication and how to take that medication. And then also, if you don't know the reasons why exercising is important after cancer treatment, you're not going to be super motivated to do it. And if we're not motivated to do it, we're not going to do it. It's hard enough to get motivated even if you know how beneficial it is. So the more education you get and the more knowledge you get on this, the more likely we might get our tushy off of the futon and maybe get out and exercise. That's the hope. So benefits of exercise. And this is, if anyone right now is still undergoing cancer treatment, these benefits are exactly the same, okay? It is important that you exercise during cancer treatment as well. It may be that you need an oncology physical therapist to guide you through it if you are currently undergoing cancer treatment to find the best and safest way to exercise, or may not. You may be able to just do it independently or after cancer treatment as well, okay? This is beneficial in all times. Next few slides, I want you just to kind of read these and think how many of these things are perhaps things that I'm dealing with right now. The reason they're on these slides is because most people during and after cancer treatment are dealing with these things. Very common, high percentage, right? Fatigue, depression, difficulty with mobility, weight issues, whether it's underweight because of malnourishment or muscle atrophy, or overweight because of change in lifestyle, because of fatigue, because of being on a hormone Therapy such as aromatase inhibitors or tamoxifen, and holding on to weight because of that. Bone density issues, circulation issues, joint pain, very common side effect of either chemotherapy or hormone therapy. Balance issues because of neuropathy. Self-esteem issues just because of what your body and your mind have dealt with because of cancer treatment. And lymphedema, as we've spoken about. And then I left this slide as the last slide because I think these are the most important things, not that we have to, label things in importance, but quality of life, right? That sums it all together. Exercise helps with efficacy of the cancer treatment, significant improvements in survival rate with exercise, decreased risk for cancer recurrence with exercise. And then we know that exercise pumps up that immune system, which is vital for many, many reasons. I have to say, always consult with a medical doctor before you start an exercise program, okay? Exercise guidelines. General recommendations, 150 minutes of moderate intensity exercise per week. How you divvy that up does not matter at all. You can do no exercise one day, 10 minutes the next, and 45 minutes the next. Exercise can look any way you want it to be. It can be aerobic exercise. It can be mowing the lawn. It can be dancing, right? Doesn't matter. Just get moving. Now, that recommendation I just said moderate intensity exercise. There is an equation for moderate intensity exercise in terms of heart rate and all of that, but that's complex and that's not realistic for us to tell you need to do that at home. The way I like to tell people moderate intensity exercise, how to monitor that, is you can talk through it, but you can't sing through it. So let's say you're walking briskly with a friend, you're doing moderate intensity exercise. If you can still have a conversation with them, but perhaps you can't sing a song, right? Because you'd get really short of breath with that. That's moderate intensity exercise. That's the real recommendation, if possible, in terms of an exercise program. Exercise and risk for recurrence. This study, and there's tons of studies on this, okay? This is a pretty profound thing, but this particular study just demonstrates that 3 to 5 hours of just walking significantly increased people's risk for recurrence in the breast cancer population by 40 to 50%. Look at those numbers, 40 to 50%. That's huge, just from a walking program. So hopefully that's pretty motivating, right? And then also improves cancer survival. Now, although we can't hone in on one reason why exercise helps with cancer survival, we know that exercise reduces the circulation of specific hormones that stimulate tumor growth. We know that exercise helps activate genes in the body that suppress tumors. We know that exercise helps stimulate the death of cancer cells, not good cells, but cancer cells. It's pretty smart that way. It helps improve the blood flow or the vascularization of tumors, especially when someone is undergoing chemotherapy. So it helps with that drug delivery. It helps decrease inflammation. We know that inflammation is a cause of many chronic diseases, and it helps promote immune function. So this is probably several reasons why exercise is so great for cancer survival. Fatigue. Fatigue is reported 90% of people who undergo cancer treatment, and it doesn't go away right when you're done with cancer treatment. It can last or have a lingering effect for many years afterwards. Exercise can significantly reduce fatigue. It doesn't right away. So that's the difficulty with it, is you're severely fatigued. You're told you need to start an exercise program. You start it. The first couple weeks, you may be a little more tired than you were when you started it. But if you keep going, within the first month of consistently exercising, you'll notice a significant improvement in your fatigue, and then that will keep going. And there's tons of studies. Look at this, 56 independent studies demonstrating decreased cancer-related fatigue with exercise, 28 independent studies showing a significant decrease in fatigue with exercise. So it's pretty profound, but you have to stick with it when you first start. So I think this information is important because it'll give you some motivation to perhaps stick with it. Depression and anxiety. 80% of people who undergo cancer treatment or have even heard the words, "you have cancer," deal with depression and anxiety. I think everyone who's had experience that has depression and anxiety. That is a normal human emotion towards this really, really difficult diagnosis and experience in life. And we know that exercise helps reduce that. I'll let you guys read over these slides if you're really interested in that in detail when you get these slides in your email. Now, chemo brain, which I also just call brain fog because it's not only from chemotherapy. Anyone who has dealt with cancer treatment reports some form of difficulty focusing, difficulty with word finding, just a change in cognition, remembering appointments. And we know that exercise helps with cognition. Different types of exercise helps with different parts of cognition, right? So again, aerobic exercise, super great with memory and word finding ability. So aerobic exercise, a great way to go. And this particular study was looking at weight training just 1 to 2 times per week. So like that's doable, 1 to 2 times per week. And noticed in this cohort that there was an improvement in complex thinking, reasoning, multitasking, and problem solving. So can be very helpful. Meditation, although it's not a form of exercise, I think it's exercise for the brain. Meditation is not necessarily putting tons of candles out, listening to music, becoming a monk, and sitting there for 30 minutes completely clearing your mind. What meditation is, it's being present and doing something where that is what you are primarily focusing on for 10 to 15 minutes a day. So whether that's coloring in a coloring book, whether that is just taking a moment to journal, whatever meditation may look like for you, it can significantly help with your cognitive functioning as well if you do it consistently. Bone health, definitely I'm assuming that your medical team has been monitoring your bone health through your treatment and afterwards as well, because bone health is a concern. And so exercise, especially weight-bearing exercises, and I list weight-bearing exercises in the next few slides, are important for your bone health. And this study just showed weight-bearing exercise like walking just 2 times per week can improve your bone density, okay? 2 times per week, doable. Heart health and cancer treatment. There are certain chemotherapy drugs that are very toxic to your heart, as well as tamoxifen and Herceptin, if you were on Herceptin. So first of all, your oncologist should be monitoring your heart health, but also exercise will be very helpful for any long-term impacts of your chemotherapy, your tamoxifen, your Herceptin, or any part of your treatment that was perhaps cardiac toxic. I love this slide because the American Cancer Society says that for people who are not active, just starting to move is going to have positive benefits. Because I'm sitting here saying 150 minutes of exercise is what's recommended. For people who either have never exercised or absolutely stopped exercising during their cancer treatment, that's super daunting. That can be a goal, but I just want you to start doing just a little bit more than you did yesterday, and you will be getting benefits from it, okay? These slides are just for your reference, talking about the importance of sleep and some things that you can do to help promote sleep. Again, you'll get this in your email. And then neuropathy, that's a side effect of a lot of chemotherapy drugs. It can lead to balance issues. Neuropathy are nerve symptoms, usually in the hands and the feet. Weakness, numbness, tingling, temperature issues, pain issues, or hypersensitivity. For some people, it goes away once you're done with chemotherapy. Some people, it's more long-term or long-lasting. Exercise, when you have neuropathy, can help you with balance. It can help with your fine motor skills, help ensure that you don't fall, right? So we don't have issues with fractures and issues with your safety. It can also promote or bring circulation to those nerves to help promote nerve healing too. So from a neuropathy standpoint, exercise is important. Also, we have found that one of the most positive interventions for chemotherapy-related neuropathy, believe it or not, is acupuncture. And there are some particular protocols for oncology acupuncture that are specifically to help chemotherapy-induced peripheral neuropathy. So if you're dealing with neuropathy, talk to your medical oncologist about maybe finding an oncology acupuncturist in your area to help with that as well. And then I just love this slide because dancing is my form of exercise that I'm super passionate about. And they found in this particular study that dancing 2 times per week for 6 months helped with memory and balance. So it's just a really good all-around form of exercise. Endocrine therapy, if you are on any form of endocrine therapy, check out these slides when you get them in your email, talking about exercise specific to that. Because we're talking about exercise, I want you guys to be aware of several free exercise programs in your community. But I know that you guys are all over the United States. So I tried to select ones that were more virtual. Hopefully that's helpful. Moving Beyond Cancer Collaborative, all free exercise and wellness classes, although some are on site, most of them are virtual. A lot of the YMCAs across the nation have a Livestrong program. That is free exercise programs for those that have dealt with cancer. And then Capital of Texas Team Survivor, although it's a local nonprofit organization, it has a calendar that has all of the different exercise classes that are free for those dealing with cancer treatment. And there are virtual offerings there too. So hopefully with this list, you guys can find some exercise programs virtually or find things in your community that work well for you. Pelvic floor, this again is going to be just for your guidance in the future as a resource. Pelvic floor are the muscles that run from your pubic area to your tailbone. They can be impacted by cancer treatment. These slides will talk to you about how they're impacted by cancer treatment. The reason I include these is because we rarely talk about it if we have issues with sexual dysfunction, sexual pain, urinary incontinence. Those are things we often don't feel very comfortable talking to our friends, our family, or our medical team. So I have these slides here just for you to read over when you get this PowerPoint in your email. And just know that if you're dealing with any of these things, don't be shy about telling your medical team. Know that there is a specialization called pelvic floor physical therapy that can help you with these symptoms. Okay, so just know that that is a thing for you if this is of concern. And this is all here as a resource. And then just to sum everything up, the take-home message, the best and most efficient pharmacy is within our own system. Exercise, diet, living a healthy lifestyle. And I just love to ensure good health. Eat lightly, breathe deeply, live moderately, cultivate cheerfulness, and maintain an interest in life. And then a good laugh and a long sleep are the best cures in the doctor's book. I know I went through all this super quick, guys, but this is my contact info. Please reach out to me with any questions. I'm here as a resource for you in any way that you need. And I'm here for Q&A at this point in time.
All right, we had a couple of, let me take these off. We had a couple of questions come up. Let me turn these back on, actually, and put these back on. Can you speak of benefits of acupuncture and microcurrent therapy was one of them.
Yes. Okay. So in terms of acupuncture, was the question specific for neuropathy or just in general? Because I'll just in general.
I think in general, somebody, the Flouties said, one of the Flouties said, can you speak to the benefits of acupuncture and microcurrent therapy?
Yes. Okay. So acupuncture, the first thing I want to say is that there is a specialization called Oncology Acupuncture, and it's important to make sure that whichever acupuncturist you see has had training in oncology, because they need to understand the treatment you've undergone and know what's safe and what's most effective in terms of your treatment. But acupuncture is really profound in terms of its benefit for immune function, for circulation, for pain, for GI issues, such as GI issues that come along with chemotherapy, for endocrine issues. So if you're on an aromatase inhibitor or tamoxifen, you're experiencing hot flashes or weight loss issues because of that. it can be helpful with that. It can be helpful with headaches, neuropathy, cording in terms of tight tissues, scar tissue. So basically, I hate to say it this way, but it's true. Every side effect that comes from cancer treatment, acupuncture can be beneficial. Not for everybody, but I say with all of my patients, I say give it a shot because there's a lot of research out there. It's pretty profound for integrative oncology and acupuncture. In terms of
yeah. Go ahead. I'm sorry.
Oh, no, go ahead.
Oh, you were done. I agree with the exercise and the laughter. That is one of the biggest things that's helped me the most. And I do CrossFit, but not everybody can do that. I mean, I'm 8 years though out. So, but I think the movement and the exercise has helped me mentally as much as anything.
I agree. Yeah. And just a personal story. Like I said, I love dancing and I love exercising. And I had a recent injury where I had to stop doing that. And I noticed changes in mental health and cognition that I was just like, I was shocked by because I'd been doing it for so long. Right. And so, yeah, it's important physically and emotionally. Absolutely. And then your microcurrent question, there are different forms of microcurrent. If you're talking about like electrical stimulation, like a TENS unit or things like that, specific to neuropathy or in terms of nerve healing, the research is kind of inconclusive as to whether electrical stimulation can help with nerve healing. So I tell people if you want to give it a shot, sure, but there's not really any profound research that we have at the moment in terms of that being beneficial.
Is that the one where they put the acupuncture and they put like they're charging you like a battery charger to them?
Yes.
Is that what that one is? Okay. Yeah. I've
had
that.
Or they have little units that physical therapists use too with little pads that provide electricity.
Yeah.
But it doesn't do any harm. So, I mean, I say try it if you want to. Yeah.
Somebody else said, can you speak about cording? I've been getting it for about 5 months and it's very uncomfortable.
Okay. Absolutely. But first I noticed that the person asking the microcurrent specific to lymphedema. Oh, no worries. Microcurrent specific to lymphedema, no, not beneficial, unfortunately, for lymphedema. Doesn't do any harm, but yeah, not an effective treatment for lymphedema. Thank you for Alinda for helping me understand your question. Cording, yes. So there are a couple of different types of cording. There's cording that can happen from your lymphatic vessels scarring down. And that cording feels and looks like guitar strings. So the super small strings that limit your arm elevation. And you can actually see a taut band down the arm. That is quite frequently happens after surgery, after lymph node dissection. And that can improve with a stretching program. Physical therapy can help with that, but stretching the area, and there's a manual or a massage technique that can help with that. Another type of cording is tight muscle, right? So the tight muscle of the pectoralis major, the pectoralis minor that comes down here, which can happen from the removal of tissue. It can happen from the tightness of radiation. And that type of cording, although it's not lymphatic, it is a tautness that definitely impacts your range of motion. And a gentle stretching program can help with that too. There's a recent study that I just read about like 3 days ago that stated that if you stretch aggressively for cording or for those tight muscles, meaning you're going really deep into the stretch and you're gritting your teeth because it's like, it's a real strong stretch, that actually will make your muscles guard, protect, and tighten up further. So the recommendation for cording is a gentle intensity, but a long stretch. So going into that stretch till you feel a gentle pull and then holding it for a minute, right? Holding it for a long period of time and doing it multiple times throughout the day. And there's also either oncology massage therapists or oncology physical therapists have some hands-on techniques to help with cording as well to help soften up that tissue too.
There is also, whoever asked that, there is a video. The very first Flat Out Love and Learn was my massage therapist from the Cancer Center. And she taught some type of like this for cording. And one of the people tried it and she said, I guess it really worked like that. So I've not experienced that, thank God. I haven't experienced cording, but if you need to look at a video of how to do it, we do have that too on file. So go ahead. I'm sorry.
Awesome. Recently diagnosed with bilateral ulnar nerve syndrome. Has this been something you've seen? Mm-hmm. Okay. Yeah, a lot of nerve injuries can happen because of explants or just because of mastectomies in general, because the nerves come out of the armpit area down the arm. All of that comes from the armpit, right? And so anything that's happened, scarring, tightness in the armpit area, can address the ulnar nerve. It can address the median nerve. It can address the radial nerve. And also postural changes, right? Tightness in the chest brings your shoulders forwards. That can compress the nerves too. It's a common issue. It's something where physical therapy, exercise, yoga, stretching, all kinds of interventions can definitely help with it. But you're not alone, Adrian. I'm sorry that it flares up and that it affects both arms. Definitely, if you haven't had physical therapy by someone who is very trained in oncology, ask your medical team to try to find someone, because maybe if other types of like orthopedic physical therapy haven't helped, it may be helpful to try working with someone that has more of an oncology focus.
How do you feel? Do you think cold showers and cold baths help with lymphedema or hurt lymph? I mean, does that have any effect on lymphedema? Because I do ice cold showers every day because of mental health.
Yeah. I'd say there's research on cold showers being helpful for lots of different reasons, but from a lymphedema standpoint, it really doesn't
affect it.
Yeah, I mean, not really. Because remember how we said that lymphatic swelling is different than other types of swelling, where let's say you had a knee injury and you put ice on your knee, that'll help with that swelling. With lymphedema, ice is not very effective. The treatment for lymphedema would be compression garments, a manual technique called manual lymphatic drainage, and exercise. So yeah, I mean, it doesn't hurt. It's a great thing to do, but it wouldn't be focusing on lymphatics anyway.
Does lymphedema, is it inflammation at the end of, because I mean, pain for the most part is all from inflammation.
Yes.
Okay. So like I use cannabis, a lot of CBD, and that all is for inflammation. And I think that's why my lymphedema, besides I don't want no transplant, I haven't really had any problems since.
Yeah, lymphedema is actually defined as an inflammatory disease because the fluid that sits in the tissue spaces does create inflammation because it's high protein content that brings in bacteria, it causes inflammation, it causes skin changes. So anything that you can do to promote or to live an anti-inflammatory lifestyle is beneficial for lymphatics. And although in terms of CBD, it's a newer thing, so we don't have a lot of research on it, I can tell you just in clinical practice, if people are experiencing pain associated with their lymphedema, topical CBD oil is pretty helpful for most of them. And again, I mean, that would be a great study to do, but just clinically, I have noticed that. But in general, I just tell people anything that promotes anti-inflammatory things for your body are a great thing to do for lymphatics.
Yeah, Dara, she has really, really bad lymphedema in her arm. And down in Atlanta, I gave her some of my CBD, and she was kind of dancing around, and they were like, she hasn't been doing that forever. And she's like, this saved my life. So I mean, she feels better from it. That's why I was asking what your opinion of it was.
Yeah. I've seen really great results for lots of reasons for CBD. Mm-hmm.
Yeah. Mm-hmm. Yeah, this was really good. I appreciate it. I mean, we've had people talk about lymphedema, but it's like everybody has a little bit different take on it, and different people teach differently. So you understand it better in different ways, So I think it's good to have different people teaching about this because, I mean, lymphedema and the lymphatic system, I think, is one of the biggest things that affect us after breast cancer, really.
It's true. And I think that not the medical community is not educated enough on it. They did a survey for medical doctors in entry-level medical school, and they get about 10 minutes on the lymphatic system. Once you get into the oncology specialization, they get a little bit more, but it's still not enough. So yeah, but it's important, right?
I didn't know about it until my hand was twice the size. And I was like, well, at least I'm well hung now. So,
It's it's just so frustrating. Yeah, there needs to be more education and more awareness. And that's why I'm so stoked to be able to help out with that. So.
If you guys would like to unmute yourself now, I can cop the video here if you guys would like to chat with her or unmute yourself and say something. I just like being able to, because of the safe space, I don't want to show your faces when you talk. It comes on in the recording. So if you guys have anything you'd like to say to Angela, you may at this time unmute yourself.
It was truly a fantastic presentation, and thank you.
You're welcome, Lucy.
I've been to many. I'm a nurse, but not practicing. But that was awesome.
Yay! I'm happy to help.
Your poise and your voice are well received. Thank you.
Thank you.
Along with your knowledge.
Oh, I appreciate that.
Yeah, I would second that. I think your voice is like so energetic. It really was. And I don't want to walk 150 miles a week, but it's very energetic. Not 150 miles, 150 minutes.
Like, oh goodness, Lee, no.
That's 30 minutes, 5 days a week though, you know, it's
but
not that much.
You broke it down and you really helped me. So I really, really appreciate it. I did have one quick question for you. I don't know if it's a lymphedema question. It's a Charlie horse question. Mm-hmm. If you ever got a Charlie horse anywhere in your foot, your shin, your toe, I get them in one side of my flatness. And that is the side where I had radiation. That is the side where I had an incisional rupture. So I'm just wondering could that be related to the lymphatic system?
Well, because I don't know you and I haven't seen you clinically, I'm just going to say this is just like a global generic comment. But most likely it's not a lymphatic issue. It sounds like that could potentially be a nerve issue, or a tight tissue issue, or a muscular issue. So I would recommend, and also electrolyte imbalances can be a thing in terms of hydration, but because you're getting it just on the side where you had the radiation and the lymph node dissection, it may be more of a tight tissue nerve, or a musculoskeletal thing, where you may want to just reach out to an oncology physical therapist and just see if there's some stretches that you can do or some manual work that you can do at home that may be beneficial. But it's not unheard of.
Thank you.
Yeah, lymphedema there has to be swelling involved for lymphedema. Sometimes lymphedema in the very beginning is a heaviness and an achiness before you actually see the swelling, because there is some swelling in the tissues, but it's not enough for you to actively see. But ultimately, lymphedema, there is swelling involved with that. Anything else, you guys? And I'll absolutely share those slides with you because I know I just whooshed over tons of them, but that was just because you can read those and then you can reach out to me via email if you have any questions or concerns.
Nobody?
There's Kelly is asking about anti-inflammatory foods. We have an oncology dietitian on our team, and she's done several presentations that we have on our website, specifically about that question. So that is not within my scope of practice, but there is absolutely anti-inflammatory foods. It's something you could probably look up, or on my my contact information as our website. Again, we have free educational videos there, and our dietitian does speak to that. So yes, there are, and that is a great thing to look at in terms of general health as well as lymphatic health.
Is turmeric one of those that is probably pretty good for, right?
Yes, ma'am. Yes,
right.
Absolutely.
I try to put that in some of my like oatmeal and stuff because I don't care for it, but
just shove it in there and just they have it in pill form too if you just want to.
Yeah, that's probably not a bad idea.
Again,
get the actual amount you should have. So,
and always ask your medical doctor before you do any supplementation, because if you're actively undergoing treatment, there are some supplements that can interact with your cancer treatments. So just make sure they're aware of it. All right. Well, it's been a pleasure, everybody. And I hope you guys go to Flat Out on Flat Top and have an amazing time. I can't wait. I'm so excited to just
thank you
follow
so
along with
much
you
for
guys.
everything and for this and being one of our first sponsors. Like I said, you are a doll. Thank you so much.
Oh, it's
thank you for doing
dear
that.
to my heart, you guys. Yeah. All right. Have a great Sunday, everybody. And let me know if you need anything in the future.